turn up, can they, at these private hospitals?
Alright guys, it's Jerningham here. It says numbers of police who have died in the UK from Corona-19 has risen to 203 after NHS England, the future 53 people had died in England after testing.
And so where one hospital is full, their intensive care beds are full, then they will look to an adjoining hospital to try.
Says there that the police have died, doesn't it?
Foresee a situation where patients will.
There's something going down, guys. Why is it saying the police have died in the UK for?
Where that patient goes as to
what
where
she's talking
their
about,
needs will be best met. So it may be that patients get transferred to another hospital.
Dealing with the
most important thing to
nation's independence on hospitals to provide more beds,
in the right place,
ventilators, extra health care staff, which will be made
in the capital. Are they based in London?
A week.
No, there's private independent hospitals all over the country.
People who have died
in one region.
Okay, all right. So that should help alleviate pressure around the country. We're getting loud warnings from Italy. We've had our reporters going into the intensive care units in hospitals there. I don't know, when you see those reports, is that what NHS staff are expecting in a week or two's time?
Panic buying, avoid.
I think it's very difficult to say what we're expecting. What we see coming out of Italy is horrific. But we are very fortunate because we're seeing what's happening. We've also got very good professional contacts with doctors and nurses in Italy. And so they're continually telling us what's happening, how sick the patients are, and the sort of interventions that are helping. So because we've had this time to see what's happening, that we can plan for the worst case scenario and work out exactly what we need to do.
Has risen to 233 after NHS England said future. Keeps repeating the same thing, guys. You can see here.
One of the other reports that we're running today has a warning from a consultant talking about this protective equipment and saying that despite the reassuring pledges from the Prime Minister that we heard this week, it's not getting to the people who need it, and even if it is getting to them, it's maybe not good enough. I mean, what's your perspective on that?
I think honestly, as demand increased, there was a difficulty in terms of making sure that there was enough capacity there to produce the amount of PPE that we needed, the personal protective equipment. I have been told that we do now have enough supply, but the issue is in distribution. And obviously what we need to make sure is that wherever that is
ridiculous, man.
it goes to the
I've got a new light bulb as well, guys.
So it's really
you can see that, even brighter.
Sends its data to the government in terms of what its demand is, that the right amount, the right sort of data gets there.
NHS England says there's 20,000 full convert staff will join NHS deals, includes provisions of 8,000 hospital beds.
How are people feeling?
I think it's very difficult to say how they're feeling, and it's also very different depending on which part of the country that you're in. So we already know that London has really struggled over recent days, but we also know that there are parts of the country that have only had a few patients go to intensive care, and some parts of the country have yet to receive their first patient.
I don't know.
So there's quite a big variation across the country at the moment, so everyone is feeling very differently.
Okay, all right. Very good to talk to you, Dr. Alison Pittard. Thank you very much for your time talking to us on Sky News. You're watching Sky News. Coming up. Stop panic buying so vital NHS workers can buy the food. That's the message from the government as the number of UK COVID-19 deaths rises to 233.
See, it's gone up again. Go to 1,000 probably in a couple of bloody weeks. I know I'm saying a lot of bloodies, guys, but it's true. Hey. Yes, I know. Yeah. I can't go wrong. I mean, in the army coming in, I haven't seen the army coming. This is the thing. Like, I mean, are the army already repaired in London already, or are they going to be repairing anywhere else? The TV crashed or something. Hold on a minute, guys. I think the TV's crashed. Oh no, it hasn't. Well, it crashed then. Not bloody safe. The bloody TV went off. Russia, bull list celebrity or something. Don't know why the phone's gone blurry again. I guess focusing again properly. A new Play Temple Festival. Don't know why they got so many adverts in the Sky News. It's ridiculous. I mean, is there any point to them for having so many adverts? Doesn't make any sense. Yeah. Saturday's weather. It always seems to be glowing on the globe on the TV with weathers and stuff and various other things. I don't want to know about the weather. As we know, everybody knows about. People like the weather channels, some people, but for me, it's just boring. If it's going to rain, if it's going to snow, if it's going to hail, if it's going to thunder, or going to be windy outside, or is it going to be snowing or raining or sunny? But some people like to keep on, keep up with them things and various things. You know, need to get a shave. And yes, I'm wearing my Harry Potter hat. Gryffindor, Hufflepuff, Slytherin. I can't remember the other one. Gryffindor, Hufflepuff, Slytherin. And there's another one, I can't remember its name. Griffin. I can't remember all the names of the Harry Potter films, of the things. No, I can't remember. It's kind of weird that you can't remember things over watching films in so long, but I'm just waiting for the news channel to come back on. That's why I'm speaking and rabbiting on about stuff, other things, because I don't think you guys want to be watching this. A picture of a globe spinning around on the TV on the news channel. So, I mean, everyone's seen a globe spin before, but it's spinning on the Earth anyway. Nobody said to know that. The world is not safe. But it could be safe again. Because of this illness, it's killing people. Coronavirus. I'm sure a lot of people are sick of hearing about the word coronavirus. Not the beer corona, but virus. So it's what we're going to be hearing for the next couple of weeks. Same thing with Brexit. They ran that down our throats and we're sick of it, and now we've got coronavirus now. And there's a lot of people in the UK won't be able to touch their family members and hug them because of the corona. People are keeping their distances away from people. And there's people that have got lung problems. I haven't got lung problems, but I've got asthma, so that could be in the category. People with cancer, which I had cancer 2 years ago, but I think I'm alright now, I don't know. Who knows, innit?
This is Sky News, it's 6 o'clock. Here are the headlines. Queues at the shops and stockpiling as it emerges £1 billion worth of food is sitting in people's homes while NHS workers are met by empty shelves.
We should all be ashamed that that has to happen. It's unacceptable. these are the very people that we will all need to look after.
A shortage of the equipment to protect frontline health staff, but news of a deal with private hospitals to boost NHS resources. An Italian minister asks the world
what could one say about this world we're living in? It's very crazy, but...
Italy's doctors. Also this afternoon, we'll round up some of the best moments of community spirit this week as the world battles the virus. Good evening. One of the country's most senior medics has said that the scenes of stockpiling and hoarding should make us all feel ashamed of ourselves. NHS England's medical director Stephen Powis was speaking at a Downing Street news conference where the Environment, Food
yeah,
and Rural
stockpiling, they're not even sharing the food for people.
Insisted there would be no shortage of food. Well, earlier the Prime Minister held a conference call with supermarket bosses to discuss the supply of food and other essential items. Sky's chief political correspondent John Craig reports.
Preparing for a dawn raid on supermarket shelves. Hundreds of Saturday shoppers queued around the car park at Tesco's in New Malden in Surrey before the store opened. It's scenes like this in a Sainsbury's in Putney, southwest London, that have prompted the government to appoint a director of food supply to oversee a war room set up to ensure Britain's food security. Chris Tyus,
living in a bloody war.
Nestle executive, has great experience in managing food crises, according to the government. At the daily Downing Street coronavirus briefing, shoppers were urged to be responsible and think of NHS workers. A top health official highlighted an emotional video posted by an NHS nurse this week.
People are just stripping the shelves of basic foods. You just need to stop it.
Frankly, we should all be ashamed that that has to happen. It's unacceptable. These are the very...
We're living in it's like we are in a war.
To look
I mean, it's sad to say, some people don't like the word to mention war or talk about it.
Chief said there
It's
was
like we are in one.
Food in the supply chain.
There is £1 billion more food in people's houses than there was 3 weeks ago, so we should make sure we eat some of it and be considerate, and also think about other people right across your communities and how we can all help them.
The Environment Secretary revealed that he and Boris Johnson had spoken to the big supermarket chains. He appealed to shoppers to calm down.
Be responsible when you shop and think of others. Buying more than you need means that others may be left without, and it is making life more difficult for those frontline workers, such as our doctors and nurses and NHS support staff, who are working so hard in such difficult circumstances.
Outside number 10, it was not just shoppers in the hunt for food. Since the government's appeals to shoppers to stop panic buying are still being ignored, it seems, ministers are now inevitably being asked about the possibility of rationing. After all, the Prime Minister was forced to order pubs, cafes and restaurants to close after attempts at persuasion failed. But as queues outside many stores continued throughout the day, shoppers in York said they were worried.
When I seen it on news, I didn't think it was actually going to be like happening, but then when I actually come to the supermarket, you just can't.
I think it is breaching unselfish, but I don't think people think they are being selfish. I think people are genuinely scared, and everyone's got to understand that.
The things that you really after a tin stuff, bread, there's nothing there really, it's all kind of gone.
No worries for these Londoners in Battersea Park, however, enjoying the sunshine and escaping the queues. John Craig, Sky News.
Well, we got the latest data from the Department of Health within the last hour, and it's been confirmed that 233 people are now known to have died from coronavirus in the UK. That's an increase of 56 people.
Gone up again.
Today, of which 220 in England, 7 in Scotland, 5 in Wales. And
gone up again, guys.
Has also died in Northern Ireland. Well, today the health service announced details of a deal that it's done with private health companies, which will see thousands more beds, ventilators and also extra staff to join in that fight against COVID-19. The news came as NHS staff continued to struggle with the lack of resources, particularly in protective equipment and critical care beds.
What is going on in this world? It's gone up.
Back from the brink. This hospital in northwest London was forced to declare a critical incident after its intensive care unit became overwhelmed with coronavirus patients. The hospital sent a message to staff warning that it had run out of critical care space and called on neighbouring hospitals for help to take on additional patients. It has now stood down the critical incident, but like many across the country, this hospital is struggling to cope with this pandemic. Nurses here posted these shocking photographs, wearing clinical waste bags on their heads, putting even more pressure on the government to address the lack of proper safety equipment for frontline medical staff.
It's incredibly important that staff follow the advice from the experts at Public Health England, who have described the protection in terms of personal protection, protected equipment that staff should take.
It's unreal, this is, I tell you. It's boosted up so many, or so many people are getting it.
Dr. Rosanna Allen Khan, a working A&E doctor and an MP, told us the issue was adding to the stress of an already overstretched health service.
It is absolutely paramount that the doctors and nurses and care staff that serve our vulnerable, that treat people with the disease, are being adequately protected so that not only can they protect themselves, but they can prevent themselves from spreading it to others.
Ensure that the respirator is flat against your cheeks.
Adequate protection is crucial. This
is how you put a mask on, I think.
Shows the correct equipment and procedure.
The recommended PPE components.
The understaffed NHS simply can't afford to lose any more workers. It was confirmed today 2 ear, nose and throat consultants are in critical care after being exposed to infected patients.
Healthcare workers are at the front line of receiving...
We are heading for something very bad, in my opinion, guys. I don't know if you agree with me. Some people may not, some people will, but we are heading for something really bad, in my opinion. There's something not right about it all.
Sky News that patients who suffered from a loss of smell or taste could be carrying the virus, a significant development in identifying asymptomatic patients.
Patients presenting with a loss of sense of smell and taste, which is suggestive even in asymptomatic.
You have to think if they're going to get the army in the streets.
Symptoms of cough and fever, that they may be carrying the virus and is causing the loss of sense of smell and taste. And that means that they should also self-isolate.
There will be some relief for the NHS. More details announced today of a deal to ease capacity. Private hospitals will provide up to 8,000 extra beds, extra ventilators, and almost 20,000 staff to fight the pandemic. The much-needed resources will come at a cost to the health service. Whatever it is, it will be a price worth paying. Ashish Joshi, Sky.
There's definitely going to be something in it.
Well, Sky's correspondent Katie Spencer joins us now from the Sky newsroom.
Sky News.
Katie, we had the latest figures of the number of people who have lost their lives. Another big jump there. Huge pressure on NHS resources. So this deal with private health companies couldn't have come too soon, could it?
Yeah, the numbers have just come in from Public Health England within the last hour. We now know that within England a further 53 people have died of COVID-19, taking the number of deaths in the UK now to 233. What has been a significant development this afternoon, though, is this partnership now that we're going to see between NHS England and independent hospitals.
I think the NHS is a stretch for the UK.
It is significant. It's a deal that we've never seen the like of before here in England.
Yeah.
Basically, effectively what it will mean is reallocating practically the entire capacity of independent hospitals over to the NHS. It's going to mean that thousands of extra healthcare workers can be enlisted in to help the NHS with their fight against the coronavirus, and also a lot more extra resources 8,000 more beds. We know that it will also mean nearly 1,200 extra ventilators. Of course, we've been talking in the last week about how important it is that the NHS feels that it needs more ventilators, so that means that we will be getting over 1,000 more of those. Nearly 20,000 more staff, including 700
Need 20 more thousand staff.
Will also be able to
I mean, we're short of staff as it is. Hospitals and policing and fire service, ambulance, hospitals.
At the moment it is in the process of still working out exactly what some of the details will be, but we do know certainly from one healthcare provider, the Spire Healthcare Group, they've said although the government has announced that this will kick in within the next week, Spire Healthcare is saying that they believe that they will use the next week to prepare their staff and prepare their facilities, but what they will be doing is that it will then, after a week from then, become full use by the NHS, so the entire capacity
this is ridiculous.
of their 35 hospitals.
I would have never known in my life to live in something like this, and most people probably wouldn't.
A huge amount of extra resources there to help the National Health Service.
Okay, Katie, thank you. Well, let's cross now to Sky's correspondent John Craig, who's in Westminster for us. John, you were at the daily press conference held by the government today. The focus was very much on trying to assure people that food supplies were in order and that there would be enough food for everybody. Did you get a sense sitting there that the government has this in hand? And do you think that we might see some further measures put in place to try and impose stricter rationing?
Well, Mr. Eustace, the Environment Secretary, was asked 3 times by Sunday paper journalists about government-imposed rationing, and each time he said, well, it's really up to the supermarkets, and he mentioned the fact that some of the supermarkets are already imposing rationing on certain products and certain goods and so on. The claim being made by both Mr. Eustace and the representative of the British Retail Consortium was that the food supply is there, the problem is getting it to the shops. And so Mr. Eustace, who revealed that the Prime Minister Boris Johnson, he had taken part in a phone call with supermarket bosses today, was saying that they'd come to various arrangements on sharing deliveries, relaxing rules on delivery vans and so on, to try and get more food and other products to the shops. He said he didn't really understand why there'd been such a run on toilet roll, for example. He also claimed that once everybody had stocked up with all the things that they've been buying in huge numbers, and that £1 billion figure was quite an astonishing figure from Helen Dickinson from the Retail Consortium. It was claimed that once people had stocked up, they wouldn't be then keep going back. Well, that's perhaps quite an optimistic claim. It does seem today that there's little evidence that the queues are abating or getting any shorter or smaller. As for rationing, well, as I mentioned in my report a week or so ago, Boris Johnson was simply appealing to people not to go to pubs and restaurants. When that didn't work, a few days later, he had to put a ban on that and order them to close. So it is entirely possible that the government may have to harden its stance. And it's clear that it kept being emphasised by both Mr. Powys from the National Health Service in England, that the real anger and frustration amongst government ministers and top health officials, the fact that hard-working NHS staff can't get to the shops because of people all this panic buying. So the government so far is urging restraint. There are those pictures of New Malden first thing this morning, but as I said in my report, throughout the day there were queues elsewhere as well. They weren't just first thing in the morning. So far, little sign that the government's warnings are not being heeded, and so it's possible, entirely possible, we may see some tougher action from the government in a few days' time on food supplies, even though they insist that the food and other stocks are there, it's just getting them to the shops on time.
All right, John, thank you.
I'm all right.
Well, good evening from Rome in Italy, which is now officially the country at the epicentre of the coronavirus outbreak. There have been more deaths here than anywhere else in the world, and doctors have told Sky News their hospitals are on the brink of collapse. as they struggle to deal with the
yeah,
sheer
Italy have
number
got it bad,
of
or had it
patients
bad.
here. There are now so many bodies in the north of the country, many are being stored in local churches. Well, 793 deaths were recorded
Bloody
in Italy
hell.
over the most recent 24 hours, for which figures have been declared, the highest increase in a single day so far. The Lombardy region has been worst hit, and doctors there say the figures are likely to get much worse still. The towns of Bergamo, Cremona and Brescia in particular have been overwhelmed.
Yeah.
Our chief correspondent, Stuart Ramsey, producer Dominique Van Heerden and cameraman Garwin McCluckey were granted access to the main hospital in Cremona. A warning, Stuart's report contains distressing images from the start.
They've run out of room.
Like I say, we've already seen this part of the video, guys. I hope you've all enjoyed this video. Give it a like, give it a comment, share it with your friends.
The next batch
I'll catch you guys in the next video. Thank you for joining me. And I'm hoping they're going to be sorting out this coronavirus soon. A lot of people are getting sick of it and worried about it and going to lose a lot of loved ones. It's not right. We need to come together as a community and help each other in these crises. Especially the old people need our help as well. Anyway, guys, take it easy. See you next stream. Peace. Or video.
They came
Peace.
from here, the hospital's intensive